The following portion of Live at 9 is sponsored by Memphis Vascular Center. And joining me today is their medical director and interventional radiologist, Dr. Dale Hansen III. Welcome.
Thank you. It's good to be here.
Yeah, so Dr. Hansen, a big issue in our community. What is peripheral arterial disease, or PAD?
Okay. So let's step back a little bit and just talk about the circulation in general. Everybody's kind of heard about the blood circulation. So what it is basically delivery of blood to your tissues and then returning that blood back to the heart. So the heart gets oxygenated blood and delivers that oxygen via the blood and blood vessels, the arteries, to the muscles, to the organs, and then brings that blood back via the veins to the lungs so it can get oxygen again before kind of completing that circuit. So peripheral arterial disease is a blockage of the arteries that take that oxygenated blood from the heart down to the tissues. And specifically here, what we're talking about is the muscles, mainly in the legs, are the arteries that we're referring to.
Okay, and what are the signs and symptoms that you have PAD?
Okay, so when you're using your muscles, they need oxygen to survive, they need blood. And so when you have a blockage in the artery, which is, you can kind of think of it like the interstate. If two lanes are down on the interstate, not as many cars can get through, and not as many people will be able to get to their destination. The muscle can't get enough oxygen. And what that presents as is usually initially cramping. Okay, some people can walk through life without having significant symptoms from this, but if you do have symptoms, usually it begins as you walk a certain distance, let's say 200 yards. You walk that 200 yards, your muscles need a lot of oxygen, they can't get it, so they start cramping. They tell you to stop. You stop, they get better, you do it again, and it happens again. And it can be 200 yards, it can be a mile, any different length of distance.
Let's talk about treatment.
Sure. So treatment for this used to be going in and doing a big surgery where we do a bypass graft from the artery that was normal to a artery farther down that was normal. It works well, but it is fairly extensive surgery. So now we have more minimally invasive treatments where we can go in through a very small incision, about 1/4 inch, and put a balloon in the artery and open up this blockage so that we can, again, get more blood down to the muscles that need it to work.
And what's the benefit of the minimally invasive
treatment? So you're in and out very quickly. So generally people show up about 20 minutes before their procedure. I can do the procedure with people just in a mild, like kind of sleepy sedation medicine. It takes an hour, 2 hours maybe, and then they go home about an hour afterwards. Very minimal recovery afterwards. No, like I said, the incision's about 1/4 inch. You won't notice it after about a few days. So very minimally invasive, easy to do, and very safe.
Wow. And how do we reach you?
So you can contact us at the Memphis Vascular Center, and I would encourage you, for people that smoke or have leg pain, have high blood pressure, all these risk factors that contribute to peripheral vascular disease, contact us. We want to know early so that we can prevent you from having to have a procedure. But if you do need a procedure to get better, we want to be able to do that as well.
All right, really appreciate you. Dr. Hansen, and the preceding portion of Live at 9 was sponsored by Memphis Vascular Center. Appreciate it.